So this is one of those times when I really wish the thumbnail or the title was just like clickbaity. It's like, oh, a patient gets abandoned by one hospital, literally kicked to the curb. But it's not. It's very much, unfortunately, not clickbait. A patient really did get kicked out of a hospital, and this actually happens all the time. It's something called patient dumping. And the goal today is one, to shine a light on this crappy hospital that did it, but also to show you that this does happen all the time, even though it is technically illegal, which we will talk about. And I'll tell you how you can report it so that if you see this, you can do some like vigilante justice and maybe. I don't know, we can make the world a tiny bit of a better place because this is a whole pile of poo. If you're new here, welcome. I'm Liz. I'm a family nurse practitioner. And I have seen this in my own practice as a bedside nurse. Now, I have never worked in the emergency room, so I have not seen it from that angle, but we will talk about how I have seen this all the time where patients just get offloaded and kind of abandoned to other hospitals from a inpatient point of view. So I worked on med surg, and then I switched over to pediatrics, and primarily on med surg, we would see all the time where, well, we'll talk about it. You would just get patients that other hospitals were like, no, thank you. I don't think they're going to pay us enough money because, of course, it has to do with money. And they get shipped off to somewhere else. And we'll also talk about nursing homes because it happens in nursing homes. And that is just horrific. So, hello, everyone who is here live. If you're watching on the replay, hello, welcome to you. Feel free to use the comment section like it's a live chat. It always makes me giggle when I go back and I see people commenting like that. We very much, Barbara, do live in a profits above people medical system, and it is sad. Montana Gal, hello. Thank you for shining a light on a dark corner. Exactly. It's not like fun to talk about, but when I see these news stories, that's how I kind of pick what we're going to talk about. Cause I'm like, oh, people might not know that that happens. Like I see it and I'm like, oh, I hate that that happens. I'm like, oh my gosh, like other people might not even know. So there we have it. Mr. Midwife is going to be here with our insider detail. He hails from Las Vegas, Nevada, which is where this happened. Worked for Valley Health, which is the hospital that kicked the patient to the curb, and for many years. So he'll have to let us know what it's like to work for that lovely institution. And we have Nurse Scott. Hello, hello. Sorry you can't find a preceptor. That is, again, not only is our healthcare system failing, but our healthcare education system is failing and not providing people with training. So let us dive straight in to the words. Let us dive straight into the video. Sorry, my sister texted me. She's like, where's the background? I'm trying something different. Okay. We're trying something different. I have lights. I was like, I'm going to try to learn how to use these lights. We'll see how it goes. Hello, Clayton. How are you? So where to go? Oh, here it is. Okay. So here's the article that we all wish was clickbait, but it was actually not. So this is officials respond after a patient is seen abandoned in front of a hospital by security. And if you've ever seen anything like this, please let us know in the comments, which pretty much just raises helps other people realize that this is not an isolated incident. Because again, we want to raise awareness for the crappy things so that you get just as mad as me and we can fix things, right? Okay. Las Vegas, Nevada, shocking video of footage of a woman being escorted out of a local hospital and then abandoned on the side of a street was caught on camera by News 3 crew. Take a look at this. You see two security guards carrying a woman from Valley Hospital Medical Center Friday afternoon. Valley Hospital Medical Center in Las Vegas is a private hospital. Okay. In the United States, we have essentially three different hospitals, four if you want to count the VA Veteran Affairs system. We have for-profit hospitals. We have non-for-profit hospitals. That's the biggest chunk. I think 60% of hospitals in the US are non-for-profit, even though they make millions and millions of dollars, but that's a story for a different day. And then, so those are the ones that they get tax breaks, right? Non-for-profit, because technically they don't make money, even though their CEOs make millions, make it make sense. Then we have for-profit hospitals. For-profit hospitals go into it literally saying this is a business. We will pay taxes. We literally are in this to make money. That is what this hospital, Valley Hospital, is. That's I think it's 20 something percent of the hospitals, and the rest are state government hospitals. And that is going to be something that is fully publicly funded. That's kind of how these break down. Okay. So we have a private hospital. Private hospitals, they get to make their own rules because they're a business, right? They get to decide who comes, who goes. It's unfortunate that that's just also healthcare, and sometimes that's the healthcare that's closest to you, or that has the shortest wait times, or that the ambulance takes you to. But bummer for you if you don't have the right insurance. So after crossing the street, you'll see the guards lay down the woman on the sidewalk, and then they leave her. So here is the video of that. If you don't like to watch sad things, maybe just skip the next 30 seconds.
I'm Jim Snyder. Let's take a look at the video we're talking about. Those are two security guards helping her cross the street with a walker. They're leaving Valley Hospital Medical Center. After crossing the street, you'll see them
literally lay her down on the curb. Like as if that's an acceptable way to treat humans.
The woman down right on the ground, the sidewalk in front of
Everyone just looks at her.
the public hospital.
And you see the guys, they're like, should we like move her over closer to the entrance? No, dude, no, dog. Just leave it. Leave her there. Leave her there. Horrific way to treat a human being.
Later, you see people gathered around her. Eventually, UMC medical personnel come out and attend to the woman. And we have just received a statement from UMC.
So then they go back and they say that, yes, this is actually verified. The hospital that they took her over to is UMC, who we've talked about for other reasons on here, but today they're fine. They at least took her in. UMC is a non-for-profit hospital, and they took her into the ER, helped her out, and treated her, hopefully, like a human being. Despite the fact, even if she didn't have insurance, even if she was underinsured. And it has been verified. UMC has, they've verified, they've said like, yes, this did happen. They've investigated it. News 3 has just reached a statement from UMC's CEO, Mason Van Houweling. I'm disgusted by the actions of Valley Hospital's employees today. You have to remember, though, it probably wasn't the employees. This all did seem very targeted at those two security guards who, to be completely fair, were probably told by administration, take this person outside, and they didn't want to lose their jobs, so they did. So is it super crappy? Yes, but it's not like the hospital employees were like, this is what I want to do. I want to take this poor woman and dump her on the street so that she's not our problem anymore because she can't pay us. So I just wanted to stand up for them. Yes, was it crappy? Could they have done this in a much better way? Should they have left her there? Heck no. Should they have deposited her taken her in a wheelchair, to the entrance of the other hospital if they're going to do this, which they also just shouldn't have done in the first place, I think, but could they have done that? Yeah. So yeah, they did it in a really bad way, but also I don't think it was their idea. But for real, just take the poor woman in a wheelchair and deposit her at the front door of the other hospital, who was in the care of their campus. The hospital, Valley Hospital personnel literally drag a patient who was in their care off their campus and onto the campus at UMC is repulsive. Repulsive is a really good word for what that was. As healthcare professionals and as human beings, we have a responsibility to care for everyone in our community rather than disgustingly dragging them out on the sidewalk as if they are a bag of trash, as those at Valley Hospital did this afternoon. That is true. That is what they did. I have spoken with the leaders of the for-profit hospital in town, including the leader of Valley Health System, about their shameful history of patient dumping, because this happens all the time here. This happens all the time here. This happens all the time at many, many hospitals in our country, if they are located near a particularly private hospital, because the private hospitals are the ones who are usually patient dumping. Sometimes it's also other for-profit hospitals, which we can talk about later. And because the watchful eye of the media team occurs at News 3, we now have this unfortunate proof that patient dumping does occur. Yes, because technically there is a law against it, very technically. And we will talk about that law and how no one really obeys it because it has to be enforced, but no one's enforcing it. And the people who are the most affected by it are people like this woman who wouldn't probably even know that that law exists, and then who are also under-resourced for being able to go and file complaints and concerns, which is why I'm mobilizing you, the internet army, so that if you see this, you can file the complaint to CMS. Okay, we'll talk about how you do that. They said that yes, the patient is being treated and will be discharged appropriately. And the Valley Health System, the one that dumped the patient on the ground like trash, said, we have started an immediate internal investigation. The security officers who are employed by a third party will be immediately counseled. I promise you, it is not the security officers who had this idea. So will they do anything? No, because their internal review will find that, oh, we kicked this person out because she probably didn't have insurance or she was very underinsured and wouldn't be able to pay us, or she had insurance that we don't take. And we get to decide that because we are a for-profit hospital. We are a business completely. So we get to decide those things. So that's where we are. Mr. Midwife says, was she homeless? No medical concerns. She was discharged, nowhere to go. They aren't going to release that because of HIPAA. I would assess. I think she probably did not have insurance, or she was very underinsured, or she had Medicare. All of those things the for-profit hospitals do not appreciate. So the way that this kind of works, right, in this setting, there is a law. There is a law that, and this is very multifactorial, which I think is what Mr. Midwife is getting to. He said, we need facts, then a hospital is not a hotel. This does circle back around to if this patient was without a home. A lot of people in that situation they go into the hospital frequently because they do not have somewhere else to go and they're not well, which also goes a step backwards to say we don't provide primary care to people. We don't provide psychiatric care to people. And we do not set people up for success unless they are pretty well, born into certain situations in life. So, yes, people do use healthcare systems inappropriately, but that's because we leave them, in my opinion, with no other choice. So that's where we are. Yes, in the words of Emily T. Baker, I have questions. I have so many questions. So that is what we are looking at here. Now, this happens, like I said, all the time. For-profit hospitals have patients that show up. Sometimes the patients even will get admitted into the hospital, and then they realize that this is not going to necessarily be covered by their insurance, or they don't have insurance. And in the 80s, the government realized that this is a problem because sometimes hospitals will take you in an emergency to the closest hospital. And that is sometimes a for-profit hospital. And they were literally just making people leave. They're like, well, you don't have insurance, so we're not going to treat you. So in the 80s, the government recognized this and they were like, this is a problem. People are dying because the for-profit hospitals who do not have to accept these patients, they can just drive them away. Because if you are a non-for-profit or you are a government hospital, since you get funding from the state and a lot of funding, everyone can kind of get funding by Medicaid and Medicare, but since you get a lot of funding from the state, you have to accept all the people. You can't just turn them away. You can give them a bill later and bankrupt them. That is fine. But you have to provide care to them. But people were dying because they were showing up at for-profit healthcare systems who then said, you don't have insurance. And they were like, I'm dying. And they said, well, go somewhere that has insurance. So they decided to come up with this law. Let me pull it up. Stop sharing that screen. And we would like to pull up. It has a long, fancy name. And I don't remember particularly what it is. Is it this? It is the Emergency Medical Treatment and Active Labor Act, EMTALA. And basically what this means, it came out, like I said, a good long while ago. And I have a summary. I summarized it in easier English words. It came around in 1986 and ensures public access to emergency services, regardless of a person's ability to pay. So bonus. Will they still bill you? Yes. Will that bankrupt you? Probably yes. But you can survive the event to then go on and have another heart attack because you're like, how am I supposed to pay this $200,000 bill? But thank you. But you will live to have that second one. It requires, if you can't tell, I hate our healthcare system and think healthcare is a right. That is my bias going to this. Healthcare is a right. We should have universal healthcare. So we're not talking about if that's what we think about that today, but that is very much my bias going into this, just to be very blatantly clear. It requires a hospital. This is the EMTALA Act. It requires hospitals to screen and treat emergency conditions in a non-discriminatory manner, regardless of the ability to pay, insurance status, national origin, race, or creed. Patients must be stabilized to the best of the hospital's ability and then transferred if they can't get adequate care, or if the patient requests it, they must accept the patient's needs. They have to take care of people and at least stabilize them before they ship them off somewhere else. The Act defines emergency conditions as a condition manifesting itself by acute symptoms that are severe, that in the absence of immediate medical attention, it is reasonably expected that this person would not do well. It also counts that, like it says, if they would be in serious jeopardy, or if serious dysfunction of bodily organs will occur. So that also leaves things up to a little bit of interpretation because, at least in my experience, we had a hospital that was nearby that was private, and they would send you people that were really not well. They would just literally turn the ambulance away and be like, "Oh no, they're fine. They're not really that bad. Send them right back. Oh, you can take them over to that other hospital that has to take them." And it didn't always go well. Didn't always go well at all because they said, "Oh, it's not that bad," but they didn't even assess them, and it kind of sometimes was that bad. So in regards to the act, it is technically illegal to refuse service to patients if they are medically unstable. How unstable is defined is not well, but this doesn't apply to most other situations. So for non-emergency services, they can't, they don't have to necessarily keep providing it. So what if you're a patient and you're in the hospital and now you're stabilized, they're going to ship you to a different hospital, if they would like to, because they're not, if they're not going to get paid, they're like, "Hey, I'm not going to, this, you can't pay me, then you can't stay here," which is very much I mean, that's what this is. This is a for-profit business, right? You know what I mean? So Daniel Johnson says, as much as a paramedic, EMTALA is a joke, and it happens so much. Yes, it is largely, it's there for people who are able to enact it, right? And say "Hey, this is a violation of the EMTALA thing." But I appreciate this insight because yes, it happens all the time. Like I said, when I was working as a nurse, we saw this a lot, not from the ER perspective, but we saw this a lot from a perspective of patients would sometimes go and they would be put in hospitals, if they were in a private hospital because of an emergency, or more often than not, they were put into just a different hospital. And then they would dump all of their sickest, they would say they were the sickest. They were not the sickest patients. They would send them over to us at the bigger hospital. And they would say, "Oh, it's because they're too sick." But what it always was 100% of the time was that they had no insurance, or they had Medicare or Medicaid, which pays less than private insurance. We almost never somehow got patients who were too sick that had private insurance. I don't think maybe once or twice in all of my time there did we receive transfers who were so sick, because shockingly, the other hospital also had a very good unit, the type of unit that I was on, and they would only ever ship over the people who had no insurance, or who, we just didn't get people with insurance from them. And after a while, you were kind of like, "Huh, this is interesting." And this is happening between not even between private and non for profit. This is happening non-for-profit to non-for-profit, because if you are a bigger institution, if you get more federal funding, you can easily ship people over. This happens all the time if you have a huge medical center, right? So I worked at the bigger medical center. It was a level 1 trauma center. And they constantly sent all sorts of people over who you were like, "They're not that sick. Why did they?" But they would be like, "Oh, we can't handle this level of care over here. But you can." Oh, shocker. Wow. This person also can't pay, which is a whole other spiral into the financial system of hospitals and how, we have some hospitals that are just getting like, there's no reimbursement. They're primarily Medicare and Medicaid patients. If they have insurance at all, which it's just a hot mess because it's Medicare and Medicaid. If you do not have private insurance, basically, your likelihood of having hospital stays be reimbursed by Medicare and Medicaid to the hospital is very low, because if literally anything happens to this person while they are at your hospital, then they will say, oh, well, you stubbed their toe, so we're not paying for this whole visit. And then costs are going up. So it's a combination of people at the top are greedy, but also hospitals have to fight tooth and nail to get reimbursement from the insurance companies. And I hate it. So this very much happens. If you see it happen super blatantly, like in this case where they literally are just kicking people out, you can file the contact CMS and say like, hey, this goes along the EMTALA thing. This doesn't get reported barely ever, because oftentimes it is people who are in situations where they don't even know this law exists. They don't have the resources they don't know, oh, I should contact CMS about it, Center for Medicare and Medicaid Services. I should do something about this. You know what I mean? And that's where we are. Let's take a couple more questions, and then I will show you some different comments, and then I will show you some other ways that this kind of plays out. But it's disgusting. Very disgusting. Adchem said, so EMTALA, where are you at? Yeah, EMTALA, it's one of those, where they kind of did it and they were like, hey, this is great. But it's like, not really. Like they kind of tried, but not really. Jasmine, welcome to your first live chat. I hope you have a delightful time. Security should be charged for inhumane treatment. Security definitely could have done a lot better. I wish they hadn't been sent over there. This is Mr. Midwife said is illegal. It's illegal, but it's one of those many things where it's illegal, but it happens. J. Michael, hello. This is sad, Clayton. It is. DP says, as a case manager, so a case manager is someone who helps figure out where they take all the information for a patient and they say like, oh, you have this insurance and this is where you need to go, and you need to go home to rehab or have oxygen, or here's your meds and how are we going to get them covered? They coordinate like everything. As a case manager, this would have been discussed with administrator prior to having been done, I hope. But even when it is discussed it would be discussed with an administration. So yes, administration saying, hey, we need to look into this and see how this happened. It happened because you told them to, dumb. Like that's literally how this happened. And this all the time, like I can't stress this enough, all the time. I was looking this up on other, I was browsing the Reddits to try to see, and there were just so many people were like, oh, this happens at this hospital in Atlanta. This happens at this hospital in Baltimore, over and over and over again. So many people had stories of just people dumping people outside of ERs and being like, well, you're not my problem. So sad. Jasmine said that my first year as a nurse, this happened. My sister hospital that I worked for discharged a woman with a history of psychosis to the group home that didn't pick her up. She was on the street for 2 weeks and came to us in crisis. So hospitals will just discharge you. And whether you dump someone on the curb across from a hospital or just some hospitals will literally just discharge you. Same problem, same not okay. You can't just let people go if they are not well, which I understand is a problem because in our country, we, again, don't provide primary care. We don't provide preventative care. We don't provide psych care. And a lot of these people are unwell physically, unwell mentally, and they get to here because there is no support for them. And so they show up in the ER very sick, while also in mental crisis. So you can't say, and a lot of people are like, oh, well, you can't show up to the ER is not the place for a psych crisis. It can be both psych and the whole system is totally effed, right? Because it is both, but also you can't just dump people out on the street. If you're like, oh, well, we don't do the psych thing, it's a psych problem. Let's just dump you on the street. We need to do better than that. Nurse Scott says we've discharged people out into the street from the ER, but that's where they came from. They walked out on their own power and that's what they wanted to do. Very different than kicking someone out and saying, I know you're not well, but you're not welcome here. You know what I mean? very, very different than if someone's like, hey, I don't have anywhere to go, but I want to be discharged. That's part of the EMTALA thing, is like, you're allowed to leave. Like, if you want to go, you want to go. That lady didn't look like she wanted to go. And the patients that I have encountered, I worked in, for all of my nurse practitioner school, I did it in a federally qualified health center, which is mostly people without insurance. And the countless times that I heard of patients showing up or being kicked out of hospitals that were not for profit. So these were not even private hospitals, because they knew better than to go there. They would get kicked out of not-for-profit hospitals because they said, "Oh, you're healthy enough for discharge," and then they would stumble into our office in primary care, like literally so sick. So we just had to call the ambulance back for them and send them back. But they would discharge them because they couldn't pay. So they would say, "Oh, you're healthy enough, you're fine." People get blown off all the time when they find out that you don't have the right type of insurance, because the hospital doesn't want to deal with you. And they're like, "Oh, I'm sure it's fine." In primary care, like, I cannot even begin to count the amount of times I had a good number of patients who had no insurance because they could not afford it. They were in a gap where, like, they couldn't qualify for Medicaid, but they could not afford anything through the marketplace. Like, which I have tons of videos on how expensive that is and how ridiculous it is. So they would go to the hospital because they had serious illness. Like, they called me ahead of time. I'm like, "You have to go. Like, I don't want you to die." And then they would, like, send them home, and only to have then it be so much worse because they did have to go back, or they like it. This happens all the time. People are taken out of hospitals. And then I would tell patients, like, "Oh, I've actually had people successfully sue hospitals under the EMTALA thing, because they were able to file lawsuits and say, 'Hey, you shouldn't have discharged me. I was not well.' But you can have anyone look at you and be like, 'Oh, you're fine enough to go home. We'll just let you go home.'" Shockingly, it's never the people who have not never. It is often the people who don't have insurance or who don't have good insurance, good being, private insurance, who get to stay. It's interesting how that happens. Mr. Midwife says Valley was always good to work for. Never saw anything like that when I worked for them, which is good. I'm glad. I'm glad you never saw anything like that. But apparently it's happening now, which stinks. Many people have said granted, it's the internet, but lots of people that I was finding on the interwebs were saying that they work there, and this happens all the time now, at least. Things have gotten a lot more stressful in the healthcare financial sector, I will say, in recent years. So that could have something to do with it. But yeah, Montana Gal says, "Sure, corporate will blame the security, even though they gave the orders." Exactly. They'll be like, "Well, we don't know what they were doing. What were they doing? Blah, blah, blah." If Montana Gal says, "Our general lack of services for the poor is shameful," rageful, embarrassing. Yeah, all those words. All of those things. Let me see. Mr. Midwife said UMC is the psych center for Las Vegas, but that doesn't mean you should dump your patient across the street. If you're doing that, if you're saying, "I think this is a psych thing," you could go and literally escort her to the door and say, "Hey, let's have a safe transfer of care here." Okay. Because say you are the psych crisis center across the street, you don't dump them on the curb. You know what I mean? Like, that's just horrific. And this happens all the time because a lot of times the other hospital is not across the street, and they just say, "Yes, you're safe for discharge." Out you go. And people don't do well to say anything. Genji says, "As patients, you don't know which hospitals are for profit or not." Exactly. And shouldn't it matter, in my opinion? And it shouldn't matter, in my opinion. Healthcare isn't how it should be in the US. Sadly, here money talks. Yeah. Sometimes people do know which hospital is for profit or non for profit. I guess it depends. If you are able to speak, most people know. They're like, "Don't even take me there. Do not take me to that other hospital. Like, I have to go here." If you have insurance, usually you will know, like say you have Medicare or Medicaid, you know what hospital you can go to. You can't go to this one over here. You have to go over here. Like my insurance tells me exactly which hospital I have to go to. It is not the one closest to my house. It is not the one I would ever choose to go to, but it is the one that I have to go to because my insurance says that is the only one that you are going to go to. Also, I think next week, or maybe as a bonus episode this week, we will be talking about how even when your insurance says you have to go to this hospital, that's the only one will pay for it. Sometimes they don't pay for it because the people who work there aren't covered by that insurance. So spoilers, that's coming. But that is, yeah, you don't always know if you're dying. If you're unconscious, they don't know. They're just going to take you to the closest hospital. Where you're going to get admitted. And then once they realize, oh, you don't have the insurance you really like, for profit or not, they'll just ship you off to a different one under the guise of, oh, we can't handle that here. But shockingly, your neighbor who has the great insurance, we can handle that case. That's actually much worse than yours. It's just so interesting how that works. Which then leads, of course, to a whole, like I said, just a hospitals that are filled with people who won't be able to pay and who also tend to, if you have people coming in who are very underinsured or have no insurance, there's often a lot of other stuff going on, which then leads to a whole host of issues you're dealing with inpatient because all of your patients now have no support system. They're coming in with no healthcare previous to this. So they're all in very bad shape. They have no emotional support. They have no financial support going forward. They're panicked. There's psych stuff going on. So that's a mess. And it just makes people burn out very quickly. Montana Gal said, my son's GI infusion center told us that if he had Medicaid, they wouldn't take him. Yeah. Yes, that happens all the time. And it is very, very sad. A lot of offices, a lot of healthcare places, if you have Medicaid, which Medicaid is what you get if you are under 65 and you meet the like financial requirements where you don't make enough money. They're like, okay, we think we'll give you healthcare. But a lot of offices will not take it. Like my office that I worked at as a primary care provider, the owner didn't take Medicaid because she said they didn't reimburse enough. So she just didn't even mess with it and didn't take it, which screws a lot of people over. So you have insurance, but you can't actually use it because you can't find someone to take it. Hot mess indeed, J Rowe. Yes, indeed. Nurse Scott says the nurses and doctors never knew who was insured or not. In California, we can't ask for insurance information until the doctor has seen you. This is probably to help make sure that you can see, are they stable? Can we send them out? You know what I mean? Under this EMTALA thing. In my emergency departments, we just treated everyone and worried about insurance later. It was never an issue until someone needed an admission. So that's good. California is much more, California follows more of the rules of healthcare. The rest of the world, really, they do not. Scott, I feel like whenever you talk about your experiences working, I'm like, it's a unicorn dreamland. Okay. I know it's not. I know California has lots of issues. I grew up there, but it does sound kind of nice sometimes. Or the hospital. Jasmine said I worked for a Medicare plan and we cover a lot of inpatient things. It's outpatients that we cover like nothing. And it's very frustrating. Yes. Yes. And just because Medicaid and Medicare cover something doesn't mean they pay nearly as much as the other insurance companies. Just a fun fact, which is why hospitals and healthcare systems don't want to take patients with Medicaid because they pay so much less. So let's say you go in and you have an inpatient stay. Every night Medicare will pay, I don't know, $300. It's way more than that. When I had my daughter, it was like $15,000 a night. Medicare says they pay $200. The private insurance next to you says, oh, we'll pay $500 because, it's just the way that game is played. So which patient are you going to want to keep? The one that you can get $500 a night for, or the one you can get $200 a night for? If there's somewhere else that's a higher hospital level, are you going to try to send that patient over? Yeah, you are. And you're going to try to fill that bed with someone else who's going to pay you $500 a night, right? It's disgusting. Let me see. I'm going to go over to which one we have starred. AdChem says there's so many social issues that lead to people going to the emergency department. It's super sad to see. Yes. Yes, yes, yes. Anne Marie said, I'm so grateful working where I do. We have a lot of patients on our floor for over 120 days who are homeless. We've had a patient on our floor reading. I can do it. We've had a patient on our floor who was there for over 120 days who was homeless and had a stroke due to a CVA, cerebral vascular accident, stroke due to heat stroke. He had no place to go and no insurance. And this makes me sad. We had a ton of people like this who would just sit on the unit because they couldn't find, we were like the last place to go because we were the level 1 trauma center. So there was no place to send them, but places wouldn't take people because they don't have insurance. So you couldn't let them go, right? Because these people were obviously not well. They didn't need to be in the hospital because they weren't that sick, but they were not well enough to be on their own, but they had nowhere to go. And yeah, it's a whole thing. D. Kelly says, I work in a non-for-profit and we have to provide home health, durable medical, which is like medical equipment at home, physical therapy, occupational therapy at the hospital expense to provide a safe discharge. Yeah. And this ends up landing on the hospital that is discharging the patient then, which is also a reason why a lot of hospitals try to shuttle patients away who don't have insurance or who have like Medicaid or who they think like aren't going to be able to pay for any of this. They say, oh, we're going to transfer you because it's the hospital who has you last that has to make sure by law, if they're following the law, which some hospitals are, they have to send them home safely under this EMTALA. Like they have to send them home safely. They have to make sure that it is safe. They don't always. I mean, I have seen many people sent home where it was not a safe situation to send that person home, but they did it because that's what happens in the real world in healthcare. But yes, a lot of these hospitals then pay themselves to, provide all this care for these people, which then raises the cost for everyone else. And that is how we are in this situation where healthcare is such a disaster because people it's just such a mess. It would be so much easier if we just did it a very different way. Florida also will treat you in the ER, Jen says, with no insurance, but will tell you to talk to financial services to set up payment plans. I think everyone talks to someone in billing as soon as they're in the ER. I know in Michigan, anytime I've been in the ER, in Michigan and in North Carolina, and someone like right after I was in bed and whenever I've had to take my children there, they immediately came in with all the financial papers and they were like, are you able to speak? Okay, great. If you could just stop barfing for one moment, then let's go and fill out all this paperwork. Tell us what kind of insurance you have, blah, 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 blah. So that is where we are. Anne Marie, this is the person who had been on the floor forever, said he's part of our family now. We have so many like it. Yeah, I can think of so many people that were on our unit like that for like so long. Some of them very fondly, I think of, and some of them made our lives hell, like awful. Because again, we're not very good at treating the whole human. So there's a lot of lifelong, unanswered, like just if you have, I can't imagine being that terrified too, being in the hospital, knowing you have nowhere to go, you have no insurance, you have no way to pay for this, you have no support system. So you're going to act out probably, right? But that makes being a nurse in the hospital very, very difficult when you have someone calling 911 every day, throwing bodily fluids and everything coming out of their body they throw at you every time you enter the room, because they're so frustrated at the situation, which is not cool. Not okay of them, but also like so bad. There's definitely no easy answer. I agree, Mr. Midwife. I agree. The nurse Adrian, hi Adrian, said patient dumping was big in the news 15 to 20 years ago, and laws changed but are now just ignored. Yeah. So 15 to 20 years ago was that? Yeah. 15 to 20 years ago was like early 2000s. And that was, they were like changing the EMTALA laws a little bit. And that was when that paper came out that I showed you, this one, which I have all of these linked down below. This was basically an article from 2001. And it's saying in the emergency medical treatment and active Labor Act. Oh, so it works for people who are in labor too. You can't turn away people who are in labor because that was happening. So that's why that last part is in there. What it is and what it means for physicians, because in 2001 we didn't acknowledge that advanced practice providers existed yet. So this just kind of goes through like, hey, this is what this actually means for you back then. Scott remembers it. M says absolutely everything gets dumped in the emergency department. Yes, it does. Again, because we have a system that focuses on crisis. We let everyone get to crisis instead of helping them in the beginning, where we could have done things a lot sooner and a lot cheaper. No, we wait till you're in crisis and then you enter. Jasmine Alexandra said the lady I mentioned earlier was with us for 4 months. We rolled out the red carpet when she was discharged and she was happy. That's adorable. I love that. D. Kelly, this goes into the next conversation we're going to have. Rehab facilities will not take uninsured with a safe discharge, so they get sitting in beds. Yes. 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 So we also ran into this problem, as we've discussed here momentarily, of rehab places not taking patients. So a lot of times people are in the hospital, they are too sick to go home by themselves. They either don't have someone that can take care of them at home, or the person who could take care of them is old, like cannot take care of a whole nother human, right? Because you're going to have to be helping them go to the bathroom a lot of times or do all these things. Say you had surgery. You need people to help you. And if you don't, you have to go to rehab. This becomes problematic if you don't have insurance, because rehab's like, no, I'm not going to take this person. They aren't going to be able to pay us. And since healthcare is a business and we have people without insurance, that's a problem. And also a problem if you have Medicaid. Once again, we come back to the Medicaid, Medicare problem, because rehab's like, I don't want to take this person who has Medicare and Medicaid because they're going to only pay me $200 a night versus this other person who's going to pay me $1,000 a night. So we see patient dumping, which this is heartbreaking, also happening in not only like inpatient facilities, but it is also happening in nursing homes and rehab centers. So this article is from a little while ago, 2020, and it's talking about how during COVID, you had a ton of people who would come through and basically get kicked out or discharged, and they would say, oh, you're healthy enough, you're fine, you're going to be able to, you can leave, we're discharging you. Don't have anywhere to go. They're very much not fine enough, but they're going to fill the bed with someone who's insurance is going to pay them more. And this article was just highlighting how it's not only rampant in hospitals, but it's also rampant in nursing homes. It goes into what is patient dumping. Patient dumping is also known as an involuntary discharge. So someone who doesn't want to go home is being sent home. It is the wrongful and illegal eviction of a patient from their facility without meeting a certain criteria. The criteria being, this is safe. For example, this may and often does occur when a resident is sent off to a hospital to receive temporary treatment and the nursing home gives away their bed to someone else. When a patient is released from the hospital and wants to return to the nursing home, they are denied readmittance. This is a common way for, in my experience, nursing homes to offload patients and dump them. Would be they would sometimes even just send them to the emergency room and say, oh, I'm worried they had a UTI. They seemed confused. Talk about symptoms that were not very concrete. And this I would get from like reading the notes when they eventually got admitted up to the floor. And you came to find out that this person was like, if usually fine, maybe they had something very minor with that they were found. And so they would have to get admitted though, because as soon as they were like, oh, actually this person's fine, they go back to call back to the nursing home. The nursing home like, oh, we filled their bed. They were like, it's been 8 hours. And they were like, yep. But their bed's full with someone else who had insurance that was better and was going to pay more. So this is a problem all over. Why does it occur? The reasons may be layered and circumstances varying from case to case, but the bottom line is money. So money. And this goes through to explain that like in California, the average Medicaid, Medi-Cal reimbursement for a rate of a nursing home is $220 per day, but the Medicare reimbursement can be as high as, so Medicaid again, for people with, it's kind of varies. Like if you're under 65 and you meet that financial requirement, or you have long-term disabilities and can sometimes apply. If you have Medicare though, you get $1,000 a day. So who are you going to take? You're going to take the person who is going to pay you $1,000, and you're going to try to get all of the people out of your facility who are paying you $220 a day. You're going to do that by sending them over to the ER. And the ER is going to take that person and they're going to say, well, I don't want to deal with you. I'm just going to discharge you. I'll just dump you on the street. Problem. Or I don't want to deal with you. I'm going to send you over to this other hospital saying that you're too sick to be here. And then we at the other hospital would get your admission or your transfer and we'd be like, you're fine. Why are you here? And the patient doesn't know. They're like, I don't want to be here. This is farther from my only child who was able to come and see me. Now they can't come and see me because we don't have a call, like it is a mess. It is patient dumping on the rise due to COVID-19. Again, because they would get more money in nursing homes from people, even with private insurance, who needed a spot with COVID-19. So then they took those people. So this is an example of how that is kind of how this happens. Like that. Also, the early 2000s, I felt that on a visceral level. Yes. When I realized that I was reading something else the other day and I was like, 23 years ago. And I was like, in 2000, like when I was very sentient and very much when I was 11. I remember that. That's yikes. Yikes. So that is where we are. The Scott says the healthcare system is better about handling crisis and sucks at prevention. Yes, possibly because people tend to be the same way. Prevention is hard as hell. It's also hard when you can't get in. So I think if we made primary care more accessible and we let people actually talk about their issues and appointments weren't 15 minutes long and appointments at your primary care weren't $160 if you did have a concern, and we actually were able to give people education, I think that would do a lot of good. Primary care is not well utilized because it is very expensive. It's pretty useless. That's why I left. Don't, Scott, just cover your ears. If you're in nursing NP school to be in primary care, just cover your ears. So I left because I couldn't do my job. And I was like, this is BS. I'm leaving because I can't take it. I can't take how I cannot do my job. I can't educate people. People can't come back for appointments. You come in and see me and I'm like, please follow up. I need to make sure this is fine and that this worked. Can't come back because they can't afford it. Yes. Nurse Adrian says there's no reward for prevention for providers. Exactly. Primary care gets reimbursed. Not only do we have to do everything with no time, and we have you're in primary care, everything gets dumped on you because I can't afford to go to a cardiologist. You're until I hit my deductible, I have to pay you $160 every time I see you. But if you want me to go to a cardiologist, that's $350 and I cannot afford that. So I'm in primary care scrambling, trying to figure out how to fix you in a way that is above my level because I'm not a cardiologist. And then cardiologists are getting paid $300 for their visit and I'm paid $80. Make it make sense. So yes, there's all the financial benefit. People who are in extreme situations like surgery or crisis, they're the ones making all the money. There's zero incentive for people to try to go into primary care. There's zero incentive for patients to go to primary care because we can't do anything with you. We're so overwhelmed. Thanks for coming to my rant session. Jasmine said, this is my hell every day. I think I need to get out of insurance. It's like I can't advocate for patients who clearly need skilled nursing homes and inpatient rehab. Yes, they won't go there unless they have the good insurance. Nurse Adrian says, if healthcare incentivized health instead of disease and the number of diagnostic codes used for reimbursement, we would have different outcomes. We would. It would be so nice if, and so much cheaper because since we wait till people are in crisis, right? So they come to us at a very sick, very unwell state. It's very expensive to fix them at that point because also the people who are fixing them now cost the most money. Also, the problems are so much more versus if we just paid to help them in the beginning when you could just pay me to talk to them for 15 minutes about what diabetes actually is. Maybe they wouldn't be having their foot cut off, but it's just me. how do we fix this problem? We can complain and still find no solution. You can vote for things like healthcare for everyone. But more realistically, if you see this happening, you can report it. So you can call Medicare and Medicaid are the ones that do not like this because it is a law. So you can report it. And that's really all I have for us on that term of what we can do. So you can call them and you can say, hey, I see a violation of the EMTALA thing, which I will leave linked down below. And you can just say, report it. What facility is it at? What is the situation? And maybe they'll get investigated. Again, very few people. The reason why EMTALA is a joke and is not really enforced is because the people it affects the most are the least likely to realize that it exists and the least likely to have the ability to do anything about it. So reporting it to Center for Medicare and Medicaid Services is a great start. And letting the people know who are getting discharged to do the same if they're in a mental state to be able to do so, or telling like family members with them, writing it down. You could just write the act down and be like, this exists. If you feel like, if it was me, because I am a troublemaker, I would say, if you don't agree, the patient's probably like, I don't agree with being discharged like this. I don't want to be discharged. I don't want to be transferred. I don't want to do this. Just hand them that. I would have little cards and I'd be like, here, you might want to talk to these people, contact someone on this card if you feel like this is a violation of these rights. You know what I mean? That's what I would do. It's like Jasmine said, it's like playing Sudoku. Which one do you change first? Exactly. Exactly. I am biased. I think we should work on primary care, primary prevention, so that we can teach people about their health and, do all of those things and hopefully get people so that they're not at the hospital. But what do I know? Adrian's right. This is a human rights issue. And we are kind of in a situation where a lot of people who have the power to make changes here are in a situation where they have never seen, or they might have seen it, but they just don't care. They've never experienced this themselves, right? This is an issue that I truthfully did not care as much about until, and I think a lot of people are probably in the same boat. Like, I wish I was born caring this much about this situation in healthcare, but I did not know it existed because I came from a very privileged background where I was on my parents' insurance and all was well. And then I got a nice hospital job, and that hospital job was a union, and it gave me very comfy insurance. And then I got off of that insurance and I realized, and I went to go to the doctor because I was like, I'd like more Zoloft, please. And they were like, that'll be $180. And I was like, excuse me, what? What? And then I had a baby and they were like, that'll be $13,000. And I was like, what? And I realized very quickly that I had lived a very privileged life, and I did not realize it wasn't that this wasn't a problem. It's that I didn't realize it was a problem. And we have a lot of people who are making a lot of choices who don't realize it's a problem. So that's why I rant on the internet, to help other people get just as mad as me and realize this is a problem. And once we accept it as a problem societally, I don't think you can look at this as how it is and be like, oh yeah, that's fine. Like, that's fine, unless you don't have a soul. So that's where we are. So that's my tangent on that. Michaela says, I work in primary care too. Goodness, I'm glad you exist. I don't know how you're doing it. I lasted 3 years and I was dead set that I was going to work in primary care forever. I was like, I worked med-surg. Like I said, that was the unit where everyone was getting sent people to me. And I was like, why do none of you have a primary care provider? And they were like, because I didn't even know at that point. Again, this is baby Liz who had great insurance. I was like, why haven't you talked to your primary care provider? And they're like, oh, they didn't have time for me, which in my mind, I was like, oh, they just blew them off. They weren't blowing them off. They literally didn't have time for them. Or they couldn't afford to go see them. And I was like, I'm going to go change the world. And I'm going to teach all these people who don't know what their foot is gangrenous and they had to chop it off because they have diabetes that, totally just killed their foot off. I was like, I'm going to go and teach them what diabetes is when they first get diagnosed. And little Liz was so set on that. And I was like, I'm going to go change the world and be the best primary care provider ever and fix this. Then Liz went into primary care and realized I have no time. My patients can't afford to come back here. They can't afford the medicine or the treatments that I prescribe for them. So all they will pay for, the insurance companies, is pain medicine, which I don't want my people to get addicted to. They can't go to therapy for their mental health because it's too expensive. They can't go to see a psychiatrist because it's too expensive. So then they do start drinking, and then they do want the pain medicine. And oh, this is how we run into this issue because they can't afford their insulin and they're using it, they're sharing it with 3 other people. And they come in and I tell them your blood pressure is terrifyingly high. Please start this medicine, do these lifestyle things. And they say, I can't do those lifestyle things. I work 2 jobs, 3 jobs. I'm like, please come back next week and we can see if your blood pressure is lower. And they never come back because they can't afford it. And then I go and find out later, like they had a stroke and they will never be coming back to my office because they're not alive. And that happens all the time. And I was like, I can't do this. I cannot do this. I need out. So, Michaela, all of that to say, I am very impressed by you that you can stay in primary care. And we get paid the least amount. And it's just absurd. Atomic Bunny, like your name said, Nurse Liz, could you make a simple infographic about this with the contact info for Medicare on your Instagram? Yes, please hold. Please hold. Disruptors of the world who also want to hand out. I can't guarantee that your hospital will not be pissed at you. Okay. Fair disclaimer. My second opinion wrote it down. Perfect. Thanks, Rach. I can't guarantee your hospital's not going to probably like that because you're literally saying, please investigate them. So I feel like kind of on the sly, just like, here you go. But at the same time, it's true. You know what I mean? It's true. Adrian was charged $1,200 in 2003 for 2 nitro pills in the ER. That's good. That's normal. Definitely normal. Montana Gum says, you are in the right place. I came to the internet to rant. Thanks for being here, friends. If you enjoy the rants or have learned something, do like the video. It tells the YouTube gods that other people might want to get really angry. Most people don't like to watch angry content though. So YouTube smushes it down. They're like, no one wants to see this, Liz. This is ruining their day. I'm like, let me make them angry. They're like, they just want to watch cute cat videos. They don't want to do this here. They don't want to do this here. Adrian says there's a reason why the insulin Twitter parody, Lilly is, I forget how it's called, has gotten so much attention. That was the company that went on Twitter when you could like buy verifications or whatever. And they said that insulin was free. They were like, oh, good news. Insulin's free now. They make insulin. Insulin was not free. And the company was not happy. Not happy at all. Michaela S. works in primary care, says Lilly Cares is a great program for people who have Medicare and can't afford their medications. So that is an excellent place to go and look if you have Medicare patients. Thank you, Michaela. If your patient, there are good programs for some patients, but you have to fit in a very narrow box, I have found. And like I said, my patients were usually either, I would say most of them had insurance, but they had high deductible plans. So they had to hit the $8,000 mark. That's what I have had for many years. And it really makes it so you can't use your insurance because I don't know about you, but we would pay hundreds and hundreds of dollars every month just to have insurance. And then on top of that, you had to hit $8,000 before you had anything. So you didn't use your healthcare because you couldn't afford it. Yay. Sunchild, depressing rabbit hole. You just went down there. See? Yes. The internet doesn't like depressing rabbit holes, but I'm in my villain phase and all I have are depressing rabbit holes because it just makes me angry. So if you have big feelings, you can come here. Sometimes we try to do silly stories. Because yes. Judith Harper says the retired nurse here, every patient should have an advocate. Yes. Even teaching hospitals. Yes. I think everyone should get a buddy because it's impossible to navigate as a healthcare provider. Just with my own family trying to navigate insurance situations, I cannot fathom having no idea about the healthcare insurance system. I just don't know how it would. The CE user said insurance is pretty much a good cop, bad cop thing in this country. I think they're just bad. Just bad. No good. No good. We're a family of yours, and I bring my depressant rabbit holes to parties. You can imagine how fun that is. It's very true. Literally everywhere I go, I'm like, have you heard about about the fact that our healthcare system is falling apart, and here's why, and nurses are screwed. They're like, wow, you're so fun. My neighbors are like, don't talk to her. Dental is a whole subject by itself. We can't talk about dental insurance. That's too rageful. I can't touch dental. I can't because it makes me so incredibly angry. My husband we just paid, I don't even know how much money. I think it was under $2,000 we have dental insurance. We have the fanciest dental insurance we could get. But he needed to have a root canal. And they were like, oh, well, he had a crown, but the reason he needed a crown, they didn't deem necessary. They're like, well, we don't do severe crowns. I was like, what is a severe crown? So his insurance was like, we don't cover that. And so then they were like, oh, he also needs a root canal. But the place, it was like a Friday when it was like an emergency root canal situation where like your nerve ending is exposed. And they were like, well, we can't get you in until like Wednesday at the place that is covered by your insurance, but you can go over here where it's not covered. And they can get you in today because we only could go to like one place. So deep breaths. Cause they were like, oh yeah, we'll just give you drugs. We'll just give you a bunch of, opiates that then, and then we wonder why everyone's addicted to them. Because we're like, just wait, just take this pill 4 or 5 times a day. You won't be able to function. Just keep going. Mr. Midwife says premiums plus deductibles plus copay. We don't cover that. Might as well pay cash. And a lot of people do pay cash. That's why we had a lot of people at my practice that did pay cash because they were like, by the time, and just gambled on the fact that they would not have to go to the hospital because they were like, by the time I pay, we paid for my insurance $420 a month for our high deductible plan. So we paid $420, I think, a month, if not $450 a month. And then in order to use any of our health insurance, we then had to pay another $8,000 out of pocket, which we could not afford because we were paying $420 a month. Yes, take these pills and sign the bills. Yay. Exactly. And yay, brain abscess. I was like, he was going to try to tough it out. But if you don't know, tooth bacteria and heart issues, like a lot of heart issues are caused by tooth bacteria. Those are very linked because it's like right there. It can get in your bloodstream very easily. And mouths are gross. He's like, oh, I'll just try to wait. I was like, you are not dying. You are not dying. No. So we paid $2,000 on top of the insurance, that dental insurance. I cannot. We must have the same insurance, Liz. Yes, it is stupid. This is why people retire in Mexico. Yes. Yes. The fact that coinsurance and copays exist. Yeah. Yes. So yes. I just cannot. All right. Let me see if I had anything else that I was trying to rant about on here. If not, we'll just do a quick Q&A and discuss. Oh, I was going to show you the different hospitals in the breakdown of the hospitals that we have in our country, just because I thought it was interesting. And if you have any stories about this happening, do let us know, like I said, in the comments, because that just helps other people realize that I'm not crazy and strange and making stuff up and being dramatic. Because everyone's like, you're being so dramatic. Like, just go watch your kitten videos, okay? Go watch your kitten videos somewhere else. We're angry here. Fast facts on the U.S. hospitals, 2022. Just in case you didn't know, when I was diving into this, I found out. So number of hospitals in the U.S., 5,139. Non-government, so the not-for-profit hospitals are by far the most common, 2,960. Again, those will still patient dump to other hospitals that are just other non-for-profits that are just bigger. So it's not just private hospitals that are doing all the shenanigans. Very much not just them. Number of investor-owned, so for-profit community hospitals is 1,228. State and local government community hospitals, 951. These are closing at an astonishing rate. We had one near us, and it served a population that very much needed it to exist because it is surrounded by a lot of hospitals who are either private or are very known for shuttling people to other medical systems that are very, very, very far away from their homes. And then they literally cannot get back. Like they'll shuttle them into Philadelphia and I live an hour away from Philadelphia. So but then they just turn them loose and they're like, all right, bye, good luck. So they really needed that hospital, but they closed it because they don't get enough money because they have to take all the patients who have no insurance or the ones that are getting paid like $100 a night versus $300. Then there are federal government hospitals like the VA, the Veteran Affairs, and then non-federal psych hospitals, and then other hospitals. I don't know what other is, but I just thought that was interesting. So most are not-for-profit, but still the not-for-profit. Every time we've talked about a hospital on here and we're like, oh, wow, their CEO makes $12 million. That's not for profit. So I guess you technically don't make a profit if you give all of your C-suite millions and millions of dollars. One day, I'm going to get Adrienne on here and she is going to teach us about not-for-profit and how they actually how they swindle that, because it seems swindly. Maybe it's not swindly, but it seems very swindly. We're going to see exactly. Let's look at those insurance exec. And the insurance companies are making bank. Okay. They are making bank because they're reaping in, they're just collecting it. They know that you can't use your insurance because you can't afford it, but they will still take all of your money. Yes. Yes, absolutely. Perfect. Because I'm like, I've looked into before trying to explain like how non-for-profit technically make money, but don't make money. And I was like, my accountant father would be ashamed, but I was like, oh, those are, it is a swindle. Yes, exactly. They deprive like nurses, tellers, like we can't pay nurses. We can't have any more of those. I cannot keep up my 5 yachts if I do this. I cannot do it. If we have that, what are we going to do if we cannot have all of our yachts? So the fact that this is happening in the federal government is appalling. The whole thing is just appalling. I just hate all of it. The American healthcare system is all a swindle. Yes, it is, Arcadia. It is. It is all a swindle. And please report it. So the only thing we can do here is vote for change on things we want to see that are changed. Let our elected officials know. I'm stealing all of Adrienne's lines here. Let them know what you think about things like this. That's, I think, like why I talk about this stuff is so that people are aware of it, so that we can let people who can actually make differences, which is people who are like elected into offices in your state. Federal government doesn't really do anything. They don't do as much with healthcare. Okay. It's your state people, your state Senate, your state legislature who can make choices to hopefully make change, letting them know, like sending them your resume and just being like, hey, I'm happy to talk about healthcare questions with you. If you ever have anything like that, be like a resource for them, sending them personalized letters and being like, hey, this is a problem I see, like, just so you're aware, supporting different bills and stuff in your state that are going to provide improved access to like mental health services. So maybe we have less people ending up on streets like this, just things like that. So you can do things like that. You can also, like I said, report these to CMS and Medicaid and say, hey, this is patient, I was going to say patient pooping, but it's not that. It is diverting patients a different way. Patient dumping. That's why I thought patient pooping. I'm like, why would I say pooping? It's because patient dumping. That's why, which is a terrible name. Cam says, would I ever run for anything? So, yes, I'm not currently because I have no money. But I would totally run for some type of office. And all of you, if you live in Pennsylvania, better vote for me. The district I know Rachel says pooping because you have 2 children whose main vocabulary word is pooping. Yes, everything is pooping. Everything. And poop is so funny right now. I have a 3 and a 5-year-old. It's hilarious to them. It's less hilarious to me. But yes, I would run for something. The person who actually was my state representative. So I live in Pennsylvania. My state representative ran unopposed and is, I know it's going to shock you. It's going to blow you away given my comments, but the only person, he was a Republican and he was unopposed. I am not a Republican. And I was like, it looks like you need some competition, person. We'll call him Bob. It was some kind of name like that. I was like, Bob, I'm coming for you. And then I posted that on my Instagram and I was like, I'm going to run against Bob next year. And everyone's like, you don't have nearly enough money to do that. And I was like, 'cause I'm going to do it for free. You can't do it for free. But one day I would love to go and yell at people in government and make passionate speeches about and like all the healthcare things. But for now, I just write them letters, which actually does work, shockingly. This is something I had heard of. If you follow her, your nurse lawyer or niece, she had said forever ago to me in a conversation, she's like, really, you should just like reach out to your local state representatives and talk to them and say, like, I would like to be a resource for healthcare questions that you might run into. Here's my resume. This is my experience. I'm very passionate about this, and I would love to educate you on anything like this. And I actually, and I would write this person letters, and they like responded one time and they were like, oh, like this is actually really helpful because I was saying I really want to talk to you about this bill that's in the Pennsylvania blah blah blah. And they like responded. They were like, oh, this is really good insight. Thank you. For this perspective. I don't provide templates on here because I have also was told by this person because I said, what are other good ways like that I want other people to be able to contact their local people. I said, should I send out should I just have fill in the blank forms? What should I do? And they said, no, personalized letters are much better. So that's what I did. Yes. So there we go. That's my tangent on that. Would I run for office? Yes. I would like my children to be older because I know that comes with a lot of attacks. Having a YouTube channel comes with a lot of really creepy, weird attacks, as I have learned lately. And I would like my children to be a little bit older so that I can have real conversations with them about, if people say nasty things or like, here's how to be better, like just self-aware in your environment, because this world is a creepy place and people are evil. And also, I'm imagining it's a huge time suck. And how much money are we talking? I don't know. The people who messaged me, they were like, I've been involved in campaigns before just for state things like this. They were saying like $100,000. And I was thinking, naive me, I was like, I already have social media. I'm just going to start a social media account and just be really honest and answer people's questions very honestly and be like, hey, approach government as if it was healthcare. Like, hey, you don't have to agree with me. That's totally fine. I'm just going to explain things. Like, you can take that information and do what you will with it. I was like, this is going to be totally fine. I'll just like make a TikTok and make that my platform. And then they were like, no, you need like a lot more money than that. So there we are. Mr. Midwife says millions. Don't tell me that. Don't tell me that. I have none. I have none millions. I have none millions and very few thousands. So we're not, and zero extra spending money at the moment. Yeah, at least 100K. Bummer, dude. Oh, start with the school board. I will probably, I was thinking either school board or, I kind of want to get on my city's planning commission, which was something I was looking into before my life kind of fell apart here in the last, couple of months. Was my city had a spot, my county had a spot open on the planning commission, and I was going to go be on that just to learn about local government and see what the deal was, and voice my very many opinions. I was like, oh, there's a section of this where I get to decide who comes into my town and what kind of restaurants we have and like what kind of like housing developments and all of that. And I was like, yeah, I'll go. That's what it is. County commission. I was like, I'll go be a county, like go sit on that planning committee and like give everyone all my money. Mm-hmm. So, I started small. I was introduced to power at my last HOA. We don't have an HOA anymore, which is good because that one was really annoying. But I was the social coordinator of my HOA. where I lived before things went crazy. But yes, one day we'll rule the world. And we'll see. Pledge the money. Don't pledge the money. Pledging and giving are not the same. Yes. So that's where we are. Okay. Any OnlyFans? No, I don't think any. I don't. Good at many things, but that I don't think would go well. Yes. I'll just link the article down below. It was basically, I had a whole article too that I totes forgot to list, basically saying it was JAMA looking at it, Journal for American Medical Association, who we hate, but they did some research on it. And they basically said, even with this law, with the ERs and hospitals, patient dumping is literally something that happens all the time. So it literally did nothing. So I will leave that down below. And if you would like to peruse it, you very much can. But I think we've proven that point enough. OnlyFans. Pretty sure that's probably what my husband would think too. He'd be like, yeah, no. Although maybe I could be one of those, I could have an OnlyFans and I would I could lure people in. I'd be like, oh yeah, I'm a nurse. But then I would just sit there in scrubs and talk about poop. And people would probably pay for that, if we're being honest. Oh, this would be a really good time to start that coven. Oh, my compound. Yes. Welcome to my compound. Which, shameless plug, if you would like random offline I guess they're online. If you would like to be part of the private Discord of my commune, my online commune, you can join that. That's what you get when you become a member of the channel. That and random videos, but mostly Discord, where we chat and discuss all things and, watch random videos and comment snarkily on them about castles. So that is there. That's a lovely way to support the channel if you too would, if you enjoy being angry on the internet and don't like happy cat videos, we have that. Oh, yeah, people do pay for anything. That is what I have learned in life. That is what I have learned in life. I know what that was a reference to. All my LawTube people may as well form the community in Pennsylvania since I'm there so often. You might as well. I mean, you might as well. We might as well. I live pretty rural, so I'm sure we can find somewhere to build our nice community. I did talk about going and taking over the Epic, the healthcare system. They have like a whole compound of it's an epic castle type of situation. There's a YouTube video about it. You can watch it. I think we should overthrow the healthcare system and take Epic's compound take Epic's compound as our land. So we will go and overthrow it. Somehow we will be wealthy enough to buy this castle compound and we will all live there. Okay. And then I'm going to turn part of it into a homestead. You're welcome to do that. We will have chickens. We will have donkeys. There will be, you can bring your hobbies, bring your people. It'll all be fine. It'll be a good time. OnlyFans. Yes, this is what I was thinking. OnlyFans is the same jest as the great Bernadette Banner. This person, I love Bernadette Banner, went on and made Victorian feet pics on OnlyFans and made actual money, which I think she then donated, but it was so funny. She was like, I'm gonna in jest. And there we go. Epic sounds great. And then we'll be kind of humans. Yes, we can even keep the name. That's perfect. There's already a farm. Perfect. Already a farm. We'll make a garden. It's going to be very peaceful. We're going to enjoy it a whole lot. A good medieval siege. Yes. We will also need to, I'll bring people from my neighbor, my neighbor as we have now, because we are going to need some teachers. There's teachers. We have a dentist. We kind of need a mechanic. So, just go and find some people. Here is really why people, here's the reality of why people don't work in healthcare, actually write the laws about healthcare. It's a crazy idea. I know, right? Here's a real idea, I think. I don't know. It's late. My brain doesn't read. But yes, it would be lovely if the people that actually knew about healthcare wrote laws about healthcare. Mind blown. Mind blown. We need to make a video game, Grand Theft Healthcare. can you get out of the hospital without them finding out your real name so that they can bill you, but also get treated? That's how you win the game. Instead of like racing in cars, we're like stealing gurneys, stealing hospital beds, trying to steer them. That would be a very top tier level. I never was good at steering patient beds, and I felt so bad when I had to actually transport them versus a transporter because I was not a good bed driver. We will say that. Like, is whiplash one of your problems? It will be after this journey. I know you're going to the ICU because you're trying to die, but we're going to add some severe neck pain and other problems along the way because they insisted they had no transport, so I have to take you, and it won't go well. I ran into so many walls, ran into people. I have gotten stuck like in elevators where like I tried to turn and then the wheel one time like twisted and like went down into the elevator. Chaos. Absolute chaos. I was like, oh no. It's like ping pong with these poor people. And then you have the IV pole. You're trying to like wrangle that. And I don't even know how other people always did it so gracefully, especially when they had like, you would see them going down the hallway because in our hospital to get from like the ICUs, they would wheel the people through our unit. And they were like vented. Someone else is like actively bagging this patient. They are hooked up to like everything. And these people are just like gracefully like floating down the hallway. And then I have my one patient with my one IV ball. I'm like, please hold on. Don't fall out of the bed. Oh, I'm taking my patients from the ED to the ICU. Oh, my bad friend. Yes, exactly. I was like, I'm so sorry. Oh, when you hit the CT table so hard, the patient just slides over. Like bump into it. You're like, whoop, okay, well, there we go. That's fine. Oh, I don't know how they did it, but did they die? Very rarely. I don't think anyone in my time died while I was trying to transport them to a different unit. Did they try? Sometimes. Sometimes we were giving pep talks in the elevator. I'm like, please, you got to stay awake. Okay, nope, not yet. We are so close to getting you to the ICU people who can hopefully help you. Please don't. I've done CPR in an elevator many times, but I was not pushing the bed. I have fallen off of a bed while doing CPR. I was doing CPR on a bed, pushing down a hallway, and my friend did hit a wall while I was doing CPR on the bed, and I did fall off. I did get back up. The person was fine. The person did actually end up being fine, but it did hurt. They intend to keep them. If they intend to keep their limbs, keep them inside. It's not as good as steering as I am as nursing. Yes, if they were more awake, I would give them the like, if you're like at Disneyland or whatever, and they're like, please keep your hands, arms, feet inside the building or inside the ride at all times. Blah 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 blah. Paramos like manos, besos, quiero, and then you do it in like Spanish. And I used to do that, like an amusement park ride. Yes, if they were awake enough, I would give them that speech. Then there's that. Jesus, what a workers' comp case. Yeah, except no, because I was like, this really hurts. I think I have done something terrible to my body. And my manager was like, we have no one else. You are the charge nurse. Go back to work. If you're done at the end of your shift, you can go to the ER. I was like, well, who really does that? Probably should have done it, but didn't. Air France is now Liz. Oh no, as a patient with a falling nurse, I'd be worried all of a sudden I'm better. Exactly. This was me. I've fallen and I can't get up. The I've fallen and I can't get up was me when I was pregnant. And I there were several times on the floor where I had to call someone when I was like 9 months pregnant. And I was like, I'm stuck. I got on the floor. Here's the story. I got on the floor because I had to check the chest tube. Okay. And I was looking at the chest tube and now I realize I'm not moving off of this floor. And I need you to come and help me. Then the patient's parents are looking at you like, are you? And I'm like, everything is fine. Everything is fine. I am just stuck here. They're like, why are you just sitting on our floor? I can't move. People will come help me. Oh, next episode. Named your favorite lift equipment. Waste of money. Yes. I love how they're always, a lot of hospitals will have like lifts that you can use like in the ceiling, or they'll have ones where you can like, it'll help the patient stand. Yeah. And, no one has that. They have like lift teams that will come and help you. You're like, hi, my patient has soiled themselves all over and we need help getting them up and changing them or moving them over to a chair so we can fix situations. They're like, great, we'll be there in 3 hours. I'm like, well, that's not helpful. And then management's like, well, you could have called the lift team. I don't understand why you got hurt, because you could have, Jerry Chair, you could have called the lift team. You're like, in 3 hours. Yes, while I let them sit there with their like central lines covered in poop. We're talking a lot about poop. I'm sorry. Should have seen my 9-month pregnant waddling, running a code. I was turned away quickly. They turned you away though. See, they turned you away. I told a story, I think last time, about how I was doing CPR and I was 9. It was like one of my last shifts before I had my kid. And I got stuck on the crib. Like, I don't remember how I got up into the bed to do CPR, but I got up into the crib. So it's high. Like, and I have no idea how I got up there. I just remember being in the crib doing the CPR on the baby. And then we went to the ICU and I was in the crib and the baby was not doing well. And I couldn't get out of the crib because the crib is high. And I was so pregnant and I couldn't turn around because there was like no room. And then it became a whole other chaos. And then they literally had to like implement a policy that like, if you were pregnant, you could not be the one to do CPR in the crib because it was so, it was such chaos to get me out of the crib. It was not good. If you are pregnant, please don't jump into cribs. It was like I don't even remember. Like they were like, how did you even get up there? I was like, I don't know. All I know, my patient was not doing. My patient needed. Things were stopping. We needed to help. Exactly. At 9 months, she should just stabilize the crash cart. At 9 months, you're the documenter, okay? Or you're the one who. Really, why are we working if we're 9 months pregnant? But again, that's how I create policies. It really is. I have been the policy changer for like 2 or 3 different things in my career, and all of it was from not necessarily the best, not necessarily the best situations. If you are actively having a concussion, you should not stay at work. If you are very pregnant, I live here now. That was me. Literally. I was like, what can you do around me? They're like, well, you're 9 months pregnant. You're not small. I don't know how to tell you this. And you're like, they were like trying not to be mean about it. They're like, well, we like really need you to get out of the crib. I'm like, I can't get out of the crib. Like, cause like you're hanging on. And I was like, I can't jump because if I jump down, I'm going to hit my stomach, which is huge. So I'm like, and then them trying to be like, well, you're not like a petite person, because I'm like 5'10". Like, we can't really work around you very well. And it was like all these super tiny other nurses who I'm like, well, I'm not jumping down into your arms. You need to go find someone more substantial. They're like I was like, oh my gosh, I'm bringing a lift. I'm like, nope. This is a problem. This is a problem. Then Adrian says, then she had a shower chair made out of PVC pipe that cost $700 and I could have built it for $50. Yes. Which, speaking, yes. Everything in those hospital bathrooms is like so flimsy. The hospital chairs that are like literally made out of PVC pipe, the toilets that are mounted to the wall, which defies all logic. I know we're on a very different tangent, but why are hospital toilets mounted to the wall instead of on the ground, which is much more secure? All of our hospital toilets were like falling off of the wall because people sat on them. Ugh, just a mess. Flimsy and rusty. Yes. Such a mess. Such a mess. A mess. So yes, on that happy note, we should probably wrap things up before we can devolve into other further antics. They only defy gravity for so long. Exactly. And it's why? Why are things like this? I do appreciate being here. Thank you for joining my angry side of the internet. If you did learn something, do like the video. It does tell the YouTube gods that you liked it. Or you could subscribe to hear more angry rants. Like I said, you can become a channel member and get access to the Discord server. Or you could just comment. YouTube also likes comments, and I like comments. So thanks. I appreciate you being here. Remember that you, my friends, are very much not alone. Oh, wait. Yes, Black Friday Nurse Liz live. We will be having a live on Friday. I also have random Black Friday like deals. If you are in healthcare for like CEUs, I think I've talked to most of my people to try to I'm not really in the education space anymore, but I reached out to a bunch of people. I'm like, can you just like, what is your discount code for this? Because I use CEUs. I'll send on, so I'll make some kind of post with my favorite CEUs for nurse practitioners, resume type stuff. The Resume RX usually has a super sweet deal right around now of how to find new jobs so that if you hate your job, you can find a new one. I'll post all of those things because they all run their best sales at Black Friday. So I'll post those in like a community post at some point. Oh, Siri's talking to me. But yes, there will be a Black Friday event like Nurse Liz Live. There'll be a Black Friday panel discussion for people who are around. So those are our live streams on Fridays at 3 p.m. Eastern usually. And we're going to be discussing how you can now be charged for notes in some hospital, like in some healthcare systems, pros and cons. It'll kind of be like last week's. If you saw last week's where we talked about like, should you have like having access to your healthcare records, like the pros and the cons from a patient and a provider side. It was a really good discussion. Actually, I'll leave it linked down below. We had a lot of, it was just a lively discussion. We did not all agree about everything. Words are hard. Yes. Siri has entered the chat. But we're going to be talking this Friday about how now you can get charged for those messages. And again, I have mixed thoughts. The patient side hate it. The provider side actually really like it, which I didn't, shocking. I know that I would actually like something where you're charging for it. So we'll be discussing that on that day on Friday. So I'll see you at some point, hopefully for that. And if not, well, I'll see you around my angry internet corner. Thanks for being here, friends. Do know that you are not alone in this crazy world. You are more than enough. And you, my friends, can do hard things. And I will see you next time. Bye-bye. I realized I forgot to do my little dance at the end. My voice is dying.